Hello guys, today we will study about the continue of anatomy and physiology of female reproductive system. In the class we will study about the external genitalia organ or also called as vulva or also called as pudendum. In the first question we will study the vulva is lined by which of the following epithelial tissue, that is the keratinized stratified squamous epithelial tissue. This is the protective from getting injury any or trauma, or this will helps to protective in nature. Keratinized stratified squamous epithelial tissue. Overview of external genitalia organ. First part is the Mons pubis, second is the clitoris, third is the external urethral orifice, next one is the labia majora, and next one is the labia minora, and next perineum, anus, and cervix. We'll study about these parts in detail. It is the hair follicles present in the Mons pubis. Why the hair follicles present means in the hair follicles are present, that's why hairs are present in the Mons pubis, and also in the labia majora in also hair follicles are present, that's why hairs are present. Next clitoris, and next is the urethral opening, next one is the labia minora, and next one is the vestibules and posterior commissures. What is the posterior commissures? This labia majora parts are combined to this line is called as posterior commissures, and next one is the vaginal openings. First we will study the Mons pubis. What is the Mons pubis? Mons pubis is also called as Mons veneris. Anatomical location and present in front of the symphysis pubis. At puberty, hair follicles present hair growth puberty. Hair growth is in inverted triangular pattern. What is the inverted triangular pattern? Means the hair growth is in the pattern will be grow like this, inverted in triangular pattern. So Mons pubis is covered by subcutaneous adipose tissue, and Mons pubis is also called as Mons veneris. Origin of from mesenchymal tissue during embryonic development. Anklex point acts as a protective cushion during intercourse and trauma. Second part we will study the labia majora or outer lip. In the labia majora, this is the Mons pubis. This is the labia majora. It is also called as outer lip. In the labia majora, hair will be growth because the hair follicles are present, and this one connection is called as posterior commissure. Next, labia majora is also called as outer lip. Labia majora meets inferiorly to in the midline for the structure is called posterior commissures. Labia majora contains subcutaneous tissue, adipose tissue, hair follicles, sweat glands, and sebaceous gland. Adipose tissue is richly supplied by veins plexus or network of veins, in which hematoma occurs if injury occurs during childbirth. Labia majora is the homologous scrotum. Structure origin same but different function. What is meant by homologous? Means it is the structural origin same but different in function. Next, analogous. Analogous in male and female body, that is the gonads of male, female. The male gamete is testes, male, female gamete is ovary. Structural origin is different but having same function. That is the analogous. Third part is the labia minora, is also called as inner lip. This is the Mons pubis, this is the anterior perfuse, and this is the frenulum, and this is the fossa navicular and fossa cervicular, and this is the porchid, also called as inner lip. And two structure, perfuse and frenulum, anteriorly present perfuse, and frenulum is present posteriorly present. Next, labia minora meets inferiorly in the midline and form structure is called fourchette. Labia minora contains hair follicles is absent, sweat gland is absent, some amount of sebaceous gland will be present. Labia minora is homologous to penile urethral in male. The space